Module 5, Problem Solving. This webinar will address the following topics. We will explain what personal and social factors are, how they help to identify clients' needs and requirements, and how to detect what the protective and risk factors are. To map out the needs and requirements of clients, we look at the personal and social factors. Stability in personal and social factors is important for the well-being of clients. Problems often occur in multiple areas of life. Personal and social factors will provide insight in the problems that occur in the client's life. And these factors are interrelated to each other. In conversation with the client, you detect the present personal and social factors. And in this conversation, you will also see what client needs and requirements are. Let's first start with the personal and social factors. What are these personal and social factors we are talking about? We subdivided them in the following areas. 1. Judicial area. 2. Housing. 3. Education and work. 4. Financial situation. 5. Relationships. 6. Health. Let's start with the first factor. Judicial factor. When you ask client about this area, you want to know all about their judicial situation. What's his attitude towards the crime he committed? Are there any feelings of guilt and shame? But it also contains everything regarding the judicial process the client is in. For instance, does client understand his probation measure? Housing. When we talk about this factor, we want to know more about the housing and the living environment of the client. For instance, do they have permanent or temporary accommodation? Education and work. This topic concerns their attitude towards education and work. Does the client work? If so, is it temporary or is it a permanent job? And you can ask questions about his employment history. Financial situation. His financial situation will give you insight in his income and the handling of money. Are there any financial problems? And if so, what is the impact of these problems on other personal and social factors? Relationships. Is there a partner? Does he have supporting family or friends? Or did he get into trouble because of his friends? Health. This final topic will give you information about their mental and physical well-being. Is there any alcohol or drug abuse, or are there mental problems? In time, you will have a global view of the different areas of life. Now we will focus on the protective and possible risk factors. In conversation with the client, it's important to look at the protective factors. These protective factors are supportive to the client and keep them on track. It's important to maintain these factors and activate them when needed. A protective factor can be a friend who always listens and is willing to help. Another example of a protective factor can be work. This will give the client a stable income and structure. Next to the protective factors, there are risk factors. Together with the client, you detect what the possible risk factors are. You discuss if they are able to tackle the possible risks by themselves or if they need a little help from you. A risk factor can be financial problems. Together with the client, you discuss possible solutions. Maybe professional help is needed, and you can accompany them to the appointment. Financial problems can also cause stress. You can, for example, advise the client how to deal with stress. The presence of risk factors increases the chance of problems developing. Protective factors will contribute to a solid foundation and can provide resistance to risks and problems. For resocialization, it is therefore very important to limit risk factors as much as possible and promote protective factors. We spoke about identifying personal and social factors. We explained what protective and risk factors are. Now it's time for the client to take action in regards to his problems. In the training, you are going to learn how to motivate client to resolve these problems. We strengthen them with confidence and encourage them by using positive experiences from the past and using their skills and competences.